Hi, my name is Tatum Taylor. I'm going to talk to you about religion and how it negatively affects the medical field. Patient-doctor relationship, because of doctors' religious views, are typically a very bad mixture. According to the mental health, religion, and culture articles, people holding an extrinsic religious belief generally show a conservative orientation, prejudice, and authoritarianism viewpoint on what people should do with their medical history. Obstetrics and gynecology is an example of the toxic environment that religion can make the medical field. In this specific story, where this woman chose to be anonymous, she told the story about when she was 14 years old, she had to go to the gynecologist and ask for birth control to help control her thyroid and acne problems. She asked questions about her birth control, and her gynecologist refused to answer her questions because she was, quote, being safe. We can, of course, assume that these are religiously and morally based viewpoints that this gynecologist had. According to the American Journal of Obstetrics and Gynecology, among obstetrician and gynecologists who practice in religiously affiliated institutions, more than 1 in 3 has a conflict with their institution over religiously based patient care policies. Unfortunately, many OBGYNs are very inappropriate with their patients when it comes to their personal views and religious morals. These stories also have sort of the same feel to them. The first one, by another anonymous woman, told the story of how she told her gynecologist at 15 years old that she was sexually active, and her gynecologist was very inappropriate with her about it, going out and telling her stepmom because, quote, because she should know what you were actually up to. Another story by Mandy Velez told a story about how her gynecologist refused to give her an IUD because she didn't believe that Mandy was monogamous, and lied to Mandy and tried to tell her that IUDs are only for monogamous people, which is very untrue. These worst-case scenarios can affect a patient for a very long time and sometimes their whole lives. Sometimes it can be because of themselves, which brings me to my next topic. Bad medical experiences can distance the patient's relationship with their God. A lot of the time, patients can think that whatever they are going through can be punishment from God for something they have done in the past. According to the International Journal for the Psychology of Religion, religious influence on health behavior and illness as punishment for sin played in a mediating role in a number of modifiable health behaviors. Punishment from God can absolutely affect a person's health behaviors in a very negative way. Mental illnesses can also come into play when punishment from God is the topic. Again, coming from the International Journal for the Psychology of Religion, people who violate religious norms may experience feelings of guilt or shame as they may feel punishment from God. These negative feelings can be determined to the mental health of a person and can last their lifetime. These stories from personal experiences of women have obviously affected them because they have not forgotten these stories, nor will they. The religious views of doctors and patients should not affect the service given and received. With diversity, the problems with religion in the medical field can be helped. If anything at all, religious diversity should be required within medical facilities of any kind. Being religiously diverse can bring different types of people into the specific office or hospital. This happens because when there is obvious religious diversity, people feel safer. According to the Evangelical Review of Theology, faith-friendly workplaces are poised to make significant gains in the years ahead. The most important gain being the fact that more diverse people will want to work in that facility, along with more diverse patients coming in. Religious diversity also gives a higher percentage of diversity in other categories, giving more diversity all around to bring more success for individual practice or hospitals. Also, according to the Evangelical Review of Theology, companies high on religious equality also score better in other diversity areas. These diversity areas include, but are not limited to, age, race, sex, sexual orientation, gender orientation, and physical disabilities. Overall, this can all be done with the medical field as a whole comes together, but where this teaching should really start is in university or medical school. Medical education needs to reinforce the basics of professionalism between doctors and patients. According to the Dialogue, a journal of theology, medical education on patient spirituality still needs reform to introduce methods of dialogue between patients and physicians. This all starts out with the education of students who must be taught from the beginning to respect their patients, practice, and fellow peers. And as said by Al Pacino in Scarface, you don't have to love me, you don't even have to like me, but you will respect me. Which I believe is very, very important. Thank you very much.